Good evening. Hope you're doing well. And is there any other media on the line with us? Hearing none. Okay, I see that we have started the live stream. So I do want to welcome all Six Nations community members to our General Council of January 11th, 2022. Note the time, we're beginning at 6:14. We do have a very focused agenda for you tonight, community. As some of you would have seen in the social media, and if you heard me on the radio today, you'll know that we have a special guest with us, Dr. Isaac Bogoch. He is a infectious disease specialist. So what I'm going to do is I'm going to ask those community members who have already thought of a question to begin populating the comment section of Facebook with your question. And by the time Doctor gets here, we should have a full roster of questions to ask him. So we're going to be going through those with Dr. Bogoch today. While that's happening, I'm going to now focus in on the aspects of the meeting today. But before we begin the formal agenda, I do want to take a moment and acknowledge the 16 families who have lost a loved one to COVID, and ask that we do a quick moment of silence for those 16 families, in particular the most recent families that has lost their cherished loved ones. So with that, I'll ask Council just for a moment of silence while we reflect on these families and give them strength. Yawagoa Council and Yawagoa community for that and our collective strength going to all those families out there for their cherished loved ones. Moving forward, I am going to ask Council to review the agenda and ask for a mover and seconder. Any moved by Councillor Paulus Bombery, seconder. Seconded by Councillor Sherry Lynn Hill Pierce. Is there any additions, subtractions, amendments to the agenda? Sherry Lynn?
Yeah, through the scheduling, you can take off the gaming policy review.
Okay.
Due to COVID. Thanks.
Thank you for that. That's been removed. Any other changes? Seeing and hearing none, going to the vote. All in favor? Is there any opposed? Hearing and seeing none, motion has carried. Before I move on to the next agenda item, just going to remind community, we do have Dr. Isaac Bogoch with us. I'll be doing a formal introduction of his credentials when he joins. But if you do have a question, please utilize the comment feature in Facebook and we'll receive it here. And we'll be going through the questions with the doctor at 6:30. Moving on to agenda item number 4. This is a COVID strategy update. So what we'll do at this time is I'm going to share my screen, and I have about 7 slides by way of a PowerPoint to share with the community in relation to some of our recent work on the recent surge that we're seeing in COVID-19. So just bear with me one moment. Okay. So as the community knows and as council knows, we've seen a recent surge in infections within Six Nations community over the last few weeks and over the holidays, which has resulted in a few outbreaks and putting us in a state of crisis at the community level. So council certainly has recognized that and has been working on a number of fronts to bring better supports to the community. So the purpose of this presentation is to highlight some of the high-level strategies that we're going to undertake over the next few weeks to ensure that our community is armed with the best guidance, our community has the best equipment available by way of testing and masks, and that we are responding to the outbreaks that our service providers provide on a daily basis. So with that, by way of this presentation, we have reached out and gotten some additional expertise to the community. Council yesterday have invited Dr. Isaac Bogoch. He is an infectious disease specialist with Toronto General Hospital and the University of Toronto. So we held a session just to really work through a number of considerations that maybe we haven't thought of here in Six Nations, to talk about gaining in and having a better understanding of how this virus is transmitted and what strategies we can begin to employ to best protect our residents here within Six Nations. So some of these strategies we discussed with them was ultimately on communications. And, you know, in the words of Dr. Bogoch, he said, that's your number one best strategy. We have to communicate better. We have to the communications has to be timely. So we're looking at ways, and you'll see further on in this presentation, some of the new techniques that we're going to employ over the next few weeks to ensure that community members get the right information on a timely manner. We also talked about vaccination outreach strategies, knowing and understanding the importance of vaccinations. How best can we as a community outreach to those that have not received the vaccinations yet or might have some hesitancy to those vaccinations? Our current numbers show we're at about 54% total vaccination for the community, and we want to work through a strategy that's measured, and we can start driving those numbers up, you know, through new techniques and new ways. We also discussed with him better understanding of testing and masking, having a good understanding of how these tests work going forward, how the rapid tests work, and how it's important to have instructions and guidance out once we do have this equipment in place. And also going to share with you later on in this presentation some strategies we have to ensure that we get enough for all community members to consume. And we also talked with him on how best to stop transmission and strategies to stop the spread broadly. So a lot of that has formed, a lot of his advice really worked to inform our strategy for the community. I also want to report on another important meeting council had yesterday at 1 o'clock. We met with the Deputy Minister of Indigenous Services Canada to begin forming a partnership and beginning looking together on how best what we can deal with kind of the crisis state that we're in and work with them on an emergency basis through a number of avenues. So we did some advocacy on behalf of the community to ensure that we have a partner in the government to work together on, you know, additional human and financial resources. And that includes looking at areas and bringing in folks such as the Red Cross, who can assist with, you know, the number of areas where we're experiencing outbreaks. We're also seeing a serious lack of staffing as well. So we want to look at new innovative ways to redeploy our staff in a team manner, but also once we do that, there's going to be a number of gaps where the Red Cross could fill in and assist us on a number of ways. So we had that discussion with the Deputy Minister. We also talked about leveraging their expertise in additional strategies to better roll out the outreach as it relates to the vaccinations. And we'll go into a little bit more detail further on. And we also advocated to ensure that they knew the number of tests that we need within our communities. Because we are the largest populated community in the country, you know, we need a lot of tests to kind of match that. So we talked with them and we developed a strategy to ensure that at the end of the day, we get enough tests, enough masks to be able to reach each household on a number of drops to ensure that you have the mechanism and you're best protected throughout this surge. So some of the issues that we want to address through this strategy is looking at the outbreaks that are occurring in the community, whether it's Iroquois Lodge or ODG, but how do we prepare for the future and ensure that we always have a rotation and a team approach around staffing, but at the same time, when we do get to a critical state, that we can outreach to those individuals in the Red Cross to receive the assistance that we need in a timely basis. We want to, as best as we can, ensure that these outbreaks are managed and that we're moving forward in the best care possible. We also talked as council about a communication strategy, getting the information to the community in real time so that you know what's happening and that you also know what's available on a timely basis. And what we can commit to you is that, yes, we will do better. New vaccination outreach strategy, we again want to do stronger communication, but we also want to look at the strategies that relates to a mobile bus. As most of you have seen, we have a health bus that's been recently deployed in the community. So we want to look at the best ways and the safest ways to have strategies to bring the vaccination to you or bring it closer to you. And we also talked about a strategy to ensure that the rapid gene testing is available in our community. Test kits are available as well as quality masks. So we're working with our government partners, as I reported in the previous slide, to ensure that that's done. I want to talk a bit more about specifics. So these next few slides, we'll get into the specifics around the communication strategy. We know that communications is key in keeping community informed, as well as equipping community members with the essentials to protect themselves against COVID. So how are we going to do better? Well, what we're going to do, and if you've been listening to the radio, I've been going on the radio daily. I'm trying to get it around noon or just before. And giving you daily updates on the outbreaks that's occurring. I've been giving updates on what's happening at the lodge and giving updates on how we're doing with our orders of testing, and also promoting some of the credible experts that we're bringing in to the community to help us through this. Use better use of written updates, and those we are working on delivery to each household to ensure that those without internet access, without access to the radio, still get those written updates in their mailbox on a consistent basis. And implementing interactive Facebook Live updates as well as Zoom updates is going to be critical going forward to ensure that we bring in health professionals so that you can get your questions answered, because it's important that you feel safe going forward. And we want to do a reset of our COVID-19 website, as well as social media and community news outlets. So important going forward. So look for kind of a new strategy around all of those. The council is receiving daily updates on how the Iroquois Lodge is doing on a daily basis. And as of today, I can report that 30 of the residents are still positive. These cases are asymptomatic or mild, and it's my understanding that a critical care nurse was in the residence today to do the assessment of each of the residents to ensure where they're at going forward. Again, I'll be providing those daily updates on the radio as well. Also working with our government partners to ensure that human and financial resources are in place to manage these outbreaks. And we are examining the best and most efficient ways to bring in agencies, as I've stated, like the Red Cross going forward. And we got the report this morning that ODG is now open and operational. So that situation in that particular agency was dealt with. And this is my final slide. I just wanted to ensure that council has ordered enough rapid test kits to distribute to each household on Six Nations. And as I've stated, we'll be providing daily updates on the radio on when you can get your test and where you can get that from. We are also strongly advocating for full shipment of 30,000 kits at a time. But as it's been reported lately, we've only been able to receive small portions of that order. So we are planning the following. What we want to do is do a central or multi-site on the same day where community members can go get their kits. And each test kit contains 5 individual tests. We want to just do a distribution plan to ensure that we are delivering to each household on a number of drops throughout this surge. And we also want to ensure that we provide guidance on how to use the test and what to do on a positive or negative test. That will be included in your test kits. Also be instructions in there on how to self-isolate and for how long. So we have put together this strategy, and we are going to continue to monitor it going forward. It is our hope that at the end of each day, you will have the right information via the radio and whatnot. But that is the strategy that we are looking to deploy over the next few weeks. And as always, we'll continue to provide updates to the community on a consistent basis. So I thank the community for their patience. And before we get into the session with Dr. Bogoch, we have a few questions coming from council. So I'll go to Wendy and then Andre.
Thanks, Nathan, and thanks for that overview. I think it's important to provide clarity around the rapid antigen test that, we do have that very large order in, but we're getting those small partials in. And, we even got a partial order in late today, so that I'm sure within your updates as early as tomorrow, we'll be able to advise some sort of distribution to the community. But I think it's important to share how those allocations happen. Noting that we have to have a certain amount of those kits held back for Iroquois Lodge, because they count on them daily for all staff, anybody going inside and out of the lodge, for the residents of the lodge. So there has to be a number of kits there. Our ambulance services, police services, so all the essential first responders, we have to hold back a number of kits there as well, just so that there's some understanding of how that distribution process works. And of course, we have to get as many as possible out to the community in a fair process.
Excellent, Councilor Johnson. Thanks for that intervention. Very important. Audrey?
Yes, I just want to clarify, Nate, you said full shipments of 30,000 and the document says 3,000.
Sorry, that was I probably misspoke. It's 3,000.
Thank you very much. Yeah.
So, but 3,000, each kit contains 5 tests. Darren.
Good evening, community. Excellent job, Nathan. Thank you. Thanks for the advocacy. I just want to thank council for all the advocacy and setting up these meetings. Just as a matter of a quick update, the lodge staff have been meeting daily to look at redeployment and reassignments within our staff complement. So the non-clinical staff have been pretty much taken care of. We reached out to ISC and follow up to our meeting yesterday. We have a meeting tomorrow. So there has been some movement there. They're reaching out to Red Cross. So the idea here is to have a full complement of staff, because sickness spreads so quickly, this particularly with the Omicron. So if we have redundancy in staffing, that's what we're looking for in all of those high risk situations. So I just wanted to provide that update that there has been some movement, and that situation will hopefully be resolved within the next couple of days.
It's Melba, whenever. Nathan.
Thanks for that. I have Melba and then Wendy.
Yeah, thanks to everybody for all the work that has been done in the care as best we can be concerning the various health problems that we are presently dealing with. I wonder if when you say OGD, not everyone in the community knows what OGD is. So if you can explain some of those things as opposed to just the lettering, please. And can you talk about the booster, because I'm very concerned that not enough people have received the booster. And as we know, there's a great possibility that you wouldn't suffer as much if you did get one of these variants. So if you could do that, that would be great. When is it? Can they walk in? Can they make an appointment? Or if you could remind them. Many of them know, but others don't, because I know people right now that are very hesitant. And I know Lori Davis Hill, if the community doesn't know, there's a study going on with health services and McMaster University concerning the hesitancy of Six Nations and other, I think it's other First Nations are involved also. Thank you, Nathan, for all the work and admin and all the health services and those that come from Brantford to actually go into the lodge to assist and look at the well-being of our elderly people. Thank you.
Thanks for that, Melba. And absolutely, when I spoke of ODG, what I was speaking of is Ogwenidao, those that provide family and child services to our community. And just to reiterate, they are operational and back up and running today. And as it relates to the work around the booster, I'm going to defer to our expert who has just joined us, Dr. Isaac, on the importance of the third booster. So Dr. Isaac, we're just completing our previous agenda item. We just updated community on our strategy. So just finishing up that, and then I'll introduce you going forward. So I'll take one more question. We do have Dr. Isaac with us, and I'll take one more question, and then we'll move on to the next agenda item. Audrey?
Yeah, just to follow up with what Mel was talking about, Master, I know University has done a COVID hesitancy study. The preliminary study report should be ready now. And I'd like to ask if we can ask Master for that study, because it might help guide us in how we approach and get more vaccinations on the reserve. Can we do that, Darren?
I heard a yes.
Yeah, I appreciate that.
Thanks for that. Wendy, I saw you had your hand up as well.
Yeah, thanks. I just wanted to pick up on what Darren was talking about with Iroquois Lodge and the staffing situation. I know that health services and others have been doing a call out to community to see if anyone is interested or available to help at the lodge through compensation, of course, being compensated for services, just so that we can keep that rotating roster and we can fill any vacancies as we continue to deal with Omicron. So just a kind call out to community. So Darren, I don't know if there's a number or a location if people are interested and available to help, where they can call into or email into and provide their information so that we can keep that information.
We'll provide that with the sorry, Wendy, we'll provide that with Nathan's update for tomorrow and make sure we have one central number for people to call.
Okay, great. And just my last comment, appreciate the study being done at McMaster, but I think we have to talk to community and see what works best for them in terms of getting the vaccines out and doing that outreach. Thanks.
Thanks for that. See no more questions. So again, community, we will be providing daily updates on the activities within the strategy that we just laid out. And just a reminder, we do have our expert with us, and remind community, if you do have questions, to populate the Facebook Live comments, and we'll get to those questions in our chat. So without further ado, I do want to move into our next agenda item today. Really grateful to Dr. Isaac Bogoch for being with us and taking the time today to spend some time with us to share his knowledge and share his service and his expertise going forward. I see through the chat, there's a number of questions coming in, but I just want to introduce you quickly, Dr. Bogoch. Dr. Bogoch is an infectious disease specialist working at Toronto General Hospital as well as the University of Toronto. And he has quite a lengthy bio, but in particular and of interest is Dr. Bogoch has work both on an international and interdisciplinary teams that modeled both emerging and re-emerging infectious global health threats to that. And also he spent time in a number of countries working with a number of infectious disease fellowships across the world. So he comes to us with a wealth of knowledge. Maybe what I'll do is ask you, Doctor, just to quickly give a quick scope of the services that you are providing. And then I'll start feeding in some of the questions that are coming through the chat. And also you're welcome to see the questions in the chat as well. I will be going to community members first in the chat. And if there's time permitting, we will go to counselors' questions as well. So with that, welcome Dr. Isaac Bogoch, and just ask to quickly introduce yourself and give us a highlights of what you do.
Sure thing. Thanks so much, Nathan. It's lovely to be here, and thanks for that introduction. My name is Isaac Bogoch. Just call me Isaac. I'm pretty informal. I'm an infectious diseases specialist. I'm based out of the Toronto General Hospital. Do a lot of work with patient care, especially over the course of the pandemic. Seeing a lot of sick people with COVID, both in the hospital and in the clinics, and then working pretty closely with different groups to help get the epidemic under control and really help come up with better strategies to help control this at the level of the community. I'm not a government employee. I don't work for the federal government. I don't work for the provincial government. I was on the provincial task force for getting these vaccines out, and that started in December of 2020. As part of that, I worked very closely with the Anishinaabe Nation leadership, as part of a much bigger team to really help, to work with Indigenous communities and improve vaccine uptake and vaccine access in Indigenous communities. All of those programs, of course, are locally led and locally run, like what we're seeing here. And this was just a supportive role. The task force has obviously it stopped working in August. They dismantled the task force, but we had some very strong and positive relationships. And every once in a while, I get calls to help out, provide some advice, provide some input, and answer questions here and there. So I'm really here at your service just to help out along the way, address questions, talk about different strategies that might work for you, and I'll stop it at that. I think just 2 seconds on the Omicron variant, maybe, Nathan, if that's helpful. Got a thumbs up there, so I'll just chat quickly about where we're at right now in Ontario and Canada, in the sense that, obviously we've heard that COVID, obviously it hasn't gone away, and we're in the midst of a pretty sizable wave. That's a nice way of putting, we're in the midst of the biggest wave we've ever had so far to date. And you might have heard a couple of times here and there, oh, it's mild, oh, it's not as bad. And the answer is, it's not as bad as the other variant we had, the Delta variant, but that doesn't mean it's not bad. Okay, it's just not as bad as the last one that we had, but it's still bad. And of course, you probably know people, have heard of people that have got sick from this. They felt crummy. Some people land themselves in hospital. Some people are dying. Like it's serious stuff. And obviously, when so many people get infected over such a short period of time, even if a small number of those people, a small percentage of people get sick enough to land themselves in hospital, when so many get infected over such a short period of time, that small percentage still ends up being a lot of people. And that's why you're seeing things stretched, your healthcare system stretched, people are, they don't have enough staff at the grocery store, at the gas station, because, there's just so many people infected over a short period of time. I think we're going to watch cases rise really quickly. Hopefully they start to come down really quickly. We don't know when that's going to be, but probably sometime in the next few weeks, we'll start to see cases decline. It's hard to know because we're not really measuring them all that well. And again, the best thing you can do, I know people say, well, I know this person, they were vaccinated, they got infected. That person was vaccinated, they got infected. But really, the best thing you can do to protect yourself and protect those around you is get the vaccine. When you look at all the information from Canada, all the information from every single country around the world, every single country that's rolling out vaccines around the world has almost the identical data, almost identical. Okay, so all these places that have access to the vaccines that are rolling out, if you want to reduce your risk of getting sick, landing in hospital, landing in the ICU and dying, the path forward is through the vaccine. Okay, people who are vaccinated are just way less likely to get sick enough to get to hospital. They're way less likely to end up in the ICU, and they're way less likely to die from COVID compared to unvaccinated people. And again, if you don't like the Canadian data, look at any other country on the planet. It all has almost the identical graph. So vaccines work really, really well. Some people are worried about the safety. Well, you know, what about this? What about that? Remember, these vaccines have been, they started going into arms for the clinical trials in around what, March, April of 2020. Okay, we're in 2022 now, and about, I'm not going to get the number exactly, about 10 billion vaccines have gone into arms worldwide. So when people say, oh, we don't have enough information yet, remember, there's been about 10 billion doses of vaccines administered worldwide. So yeah, it's not, I'm not going to pretend to have all the answers because we don't. But on the other hand, let's also not pretend that we don't have a ton of information, because we do. So we know they're safe. We know they're effective. We know they keep you out of hospital. Yeah, you still might get infected if you're vaccinated, but you're just way, way, way less likely to get sick. And when you factor vaccines together with all the other public health things we hear about, putting on a mask indoors, improving the ventilation in indoor spaces, not gathering in big groups inside, when you put it all together, yeah, you can really help control COVID-19, and you protect yourself and you protect the community. And, you know, it sounds as simple as that, because it actually is as simple as that. So why the hell are we in the mess we're in? Lots of people aren't vaccinated. Lots of people aren't adhering to public health measures. This is really, really transmissible. And even vaccinated people are getting sick. They're just not getting that sick to land themselves in hospital. I'm going to stop blabbing on and on and on. I'm happy to take any questions you have and happy to chat. Thanks so much.
Really appreciate that guidance, Doctor. And yeah, I think it's critical going forward that the information go out to the community as plain as you've laid it out. On the vaccinations, the first couple questions, I'm taking two questions and I'm combining them. First part of the question is the importance of the third booster, the third shot. And with that, there's also a community question coming in, is if you can clarify if those 12 to 18 on Six Nations who are 6 months out from their second vaccination are now eligible for a booster. So eligibility for a booster, 12 to 16, and the importance of that third boost.
Can you believe it? 2 years in, I'm still talking on mute. Sorry about that. I think we've done a Zoom before. Nope. Anyways, I'll start with the first one because that's the easier one. Importance of the booster. 2 doses of the vaccine is really good. It's really good. 3 doses of the vaccine is better. Okay. Again, like I said a couple of minutes ago, it's not fair to say that we have all the data and all the information, but we have a lot. And all the arrows are pointing into 3 doses of the vaccine being better than 2. 2 still helps, 3 is better. What does that mean? You're going to see emerge over time. People with 3 doses are probably just not going to get as sick versus people with 2 doses. Now, at an individual level, sure, someone with 2 doses might be totally fine. Someone with 3 doses might get a little bit more sick. But when we look at, on average, what's going to happen, 3 doses will be better than 2, but it's not like 2 doses don't do anything. 2 doses are very, very helpful. People have 0 doses. I'd really encourage you now to get dose 1, then wait the right period of time, dose 2, and then dose 3. In terms of eligibility for those 12 to 18, I don't know if the rules are different on in Indigenous communities. I know outside of Indigenous communities, we are not yet giving 3rd doses to people under the age of 18. It's for 18 and up. I know sometimes things move a little faster, and if there's someone else on the call that might have the answer to this, I'd welcome it. But outside of Indigenous communities, we are not giving 3rd doses to those under 18 just yet.
Thanks for that clarification. And yeah, we are consistent with others as well. So that's good information. The next question isn't necessarily related to you, Dr. Isaac, but I will answer it. The question was related to, are our children going back to school on Monday? I know that we are following the provincial guidelines as it relates to the restrictions, but there are exemptions. We'll be continuing updating what those exemptions are. At this point, we have not heard from the federal schools on whether or not they are bringing children back on Monday. Usually we would have that update. So my answer at this point is that no, we have not heard from the federal schools on whether or not our children are going back on Monday. But again, keep abreast on the daily updates. I'll add that to the roster and keep you updated on a daily basis as it relates to that question. So doctor, this question is related to you. It is, the question for you is, since the population is 3 times compared to the Spanish flu, I'm assuming here, from 1918, and they did not have vaccinations at that time, how long do you think this pandemic would last, considering a higher world population than that was in place in 1918? Would it not make sense for a larger population that this would last longer? So will we be taking boosters for life?
Okay, I love this. This is a great question. So let's get nerdy for a second here. Number one, the flu pandemic of 1918 was influenza. So this is a totally different virus. It's a coronavirus. While there are similarities in that they're both respiratory viral infections, and we're seeing waves like we saw in the other pandemic, they still are different viruses and they might behave differently. So that's one point. The second point is, yeah, we're in a vaccine era and they weren't. So what happened in 1918 when they had that big pandemic? Well, a lot of people died, like a lot of people died. Probably the estimates are tough because it was a long time ago, but 50 million, maybe even more. Like it was a lot of deaths. Where are we now with COVID? Probably the WHO has about 5 or 6 million documented deaths, but all the estimates are closer to about 19 million deaths. 19 million deaths with COVID. It's horrendous. But influenza over the same time period had about 50 million. Because they didn't have vaccines, and it just ripped through communities, wave after wave after wave. Just because there's more people, it doesn't mean it's going to take longer, because people are congregated in giant urban settings. And you look at a place like India or Toronto or New York or Mexico City, where there's just so many people close together, it has very effective spread. The question is, and I'll stop soon, but the question is, when is this going to end? It's not going to go away. COVID is not going away. COVID is going to be around for a long, long time. What's going to change is that we gradually build up immunity, hopefully through vaccination, some through recovery from infection, some through both. And the next time a wave rolls through town, in a perfect world, it just doesn't impact us as much as it has in the past. So rather than shutting down society because our healthcare system is overwhelmed and everyone's sick, maybe you get a bunch of people with the sniffles and that's about it. So that's what we hope will happen, and that's what will probably happen eventually. But we have to get community level protection first. So you got to get vaccinated, people, and that takes time. Similarly, people are getting, it's not the right word, but boosted either with the vaccination or with recovery from infection. We obviously don't want anyone to get this infection because we don't want anyone to get sick. But that's what's happening. So over time, we'll develop enough community level protection. So we'll still have the virus. It's not going away. It just won't impact us as much. Will it be boosters for life? Anyone who looks you in the eye and tells you with a straight face they've got an answer to this, you got to be careful. A big red flag should go up. We don't know. We don't know the answer to that. I think it might be, a couple of scenarios might happen. We might get a shot a year like we do with the flu. That might happen. We might get a shot in 2 or 3 years if a new variant comes up and we're good for a couple of years. Maybe we don't need anything else after this. So the short answer is we don't have an answer yet. That's being studied very, very carefully. We'll probably know more in about 6 months if we need another dose and when.
Amazing response. So clear. So clear. The next question, and I'm kind of I want to get through these kind of quickly, but the next question is also a good one on why the CDC changed the definition of the word vaccination. And if you can please explain the difference between the previous definition and the current definition.
I can't. The CDC is American. I remember reading this, I don't know, when it got popular and got on the internet and people made a huge deal out of nothing a few months ago saying, look, they changed what a vaccine was. We know what a vaccine is. You get a little shot, you trick your immune system into thinking you're seeing the virus when you're actually not getting infected. Your immune system mounts a response. And that way, whenever you're exposed to this virus, your body says, hey, I've seen this before. I know what to do. And you fight it off. And you might fight it off enough so that you don't get infected, or you might fight it off enough so that even if you do get infected, you don't get that sick. That's what a vaccine is. I mean, honestly, when I remember when this made the news or headlines, I don't know, a few months ago, there were a lot of like bizarre conspiracy theories saying like, see, look, they changed their definition. I mean, this is just meaningless semantics at the end of the day. We know what a vaccine is. We know how they work. We know exactly what the ingredients are. And I don't think too much about it at all.
Really appreciate that. The next question is related to a previous question on, are we going to be boosted for life? You indicated you don't know, and nobody knows at this point, but the question is a little different, and it's looking at in the future, do you see vaccines for COVID as a routine thing? I think we've answered that, but especially related to the variants. So is
Right.
the change in vaccinations related to the new variants that we see?
Yeah, so currently we're using the same vaccine that we used from the very beginning. And of course, we know the virus has changed a lot since then, but the vaccines still work, right? We have data for 3 doses of a vaccine, still keeping people out of hospital and keeping you out of the ICU and preventing you from dying. Now, would a special vaccine designed specifically for Omicron be better? Maybe, and they're working on one right now. But again, I don't think it's fair for everyone just to give out vaccines willy-nilly. You have to study this. You have to have good data to drive smart policy. You can't have, crappy data and take the word of the CEO of the vaccine company saying, hey, you guys need vaccines. That's not how this works. You have to actually have good quality data and good quality clinical trials to suggest that we need some more vaccines. The world is pretty savvy. We've got good leaders and good leadership in public health in most parts of the world. And it will take, the bar is set pretty high. So we might need new vaccines for Omicron. Maybe this is coming up, maybe it's an annual vaccine like with the flu. And remember, with the flu, every year the flu vaccine changes. Every single year the flu vaccine changes. It's not the same vaccine you're getting every year. Every year they track the flu virus, and just like the coronavirus, just like COVID, the flu virus changes with time, and they take the most up-to-date flu virus that's circulating and say, this is what we're going to do, this is the one we're going to use, and this is the one we're going to make the vaccine with. So that might be very similar to COVID-19. The COVID's changed with time. They might say, you know what, this is the variant that we're going to work with, and we're going to make a vaccine for it. Maybe it's once a year, maybe it's every few years. We don't know, but I think the next vaccine will probably be different from the one that we're using now.
Thanks for that. And again, the questions are starting to get related. So the question here is, to your knowledge, is it so that the worldwide deaths, I think it's death rates being attributed to Omicron is approximately, they use the number 10. And then they ask further, are you of the opinion that we will see this virus be treated on par with influenzas in the future?
Yeah, good point. So yeah, when you look at Omicron versus Delta, and again, let's also not pretend we have answers. We've only known Omicron's existed for about 2 months, 2.5 months. Like, come on, we can't pretend to say that we've got all the answers here, because we don't. But everything we know about Omicron so far suggests that compared to the other variant that we had, the Delta variant, it's just less likely to cause hospitalizations and less likely to cause deaths. It still can, it's just less likely compared to Delta. Same with the flu, right? Someone says, like, is this going to be treated like the flu? Maybe, but guess what? The flu's serious business. Some people think the sniffles are the flu. No, the flu is the flu. The flu is serious. The flu kills 3,500 Canadians every year. The flu kills about 500,000 people on Earth every single year. Like, the flu's really bad. And guess what? We got a vaccine for it. Is it perfect? Nope. But it still does the same thing that the COVID vaccines do. It reduces the risk of you getting the flu, And if you do get the flu, it reduces the risk that you get a severe infection, just like the COVID-19 vaccines. It would be great if COVID emerged into something that was less severe than what it is and on par with the flu. Maybe that's Omicron. It's too soon to know. But even if it is as quote unquote severe as the flu, we still have to remember that that's serious business. That's 3,500 dead Canadians a year and 500,000 people per year. That's a lot. We got to be careful here. We've got a vaccine that works. We got a vaccine that reduces your risk of getting sick and dying. And you know, we should be doing everything we can to ensure that we get that. And those of us around us, our family members, our loved ones, our friends, our communities have access to this and take it up and use good information, not crap information and conspiracy theories you see online. You know, smart decisions. Smart people make smart decisions. Get the vaccine. It really, truly saves lives.
Really appreciate that. Good question, and something we're dealing with real time. So community is asking, with the outbreak currently occurring at the Lodge, which is our local long-term care home, our Iroquois Lodge, despite the requirements to rapid test before entry, what else can we be doing from an infectious prevention and control lens to protect our elders in this setting?
Yeah, that's really tough to hear. And I'm really sorry to hear about this outbreak. The first step is to protect the individuals is to really ensure that everybody has been vaccinated, right? We are seeing so much fewer severe outcomes, even in vulnerable older people who are vaccinated, and they really need all those doses. So that's one thing. The second thing is anyone going into the lodge obviously should be vaccinated as well. Is it perfect? No, but it's still really helpful. In addition to that, the rapid test can help. Again, they're not perfect. There's no perfect shield. All we're doing is in many of these settings is adding layer after layer after layer after layer of protection. Vaccines are a major layer. Masks are a major layer. Negative rapid test before you go in is another major layer. Where improving the ventilation in those settings is another major layer. Stopping people from having, you know, big indoor gatherings together and keeping the gatherings as small as possible is another layer. So those are the meaningful layers. And again, it's not perfect, but the more layers you have, the more safety you have, and you can really protect those people who are inside. And again, let's appreciate that this is a vulnerable group. Many people are older or more frail and more at risk of a severe infection. So it's important to really use all the layers that we have to protect those inside.
Important message I heard there was it's as important as what we do inside the lodge as outside the lodge too. So thank you for
Absolutely.
that. Another question, how many times are we allowed to wear an N95 mask? And is there anything we should be doing in between point when we're not wearing one?
No, you can wear it as many times as you like, but you just got to watch it because it is a paper-based mask. And if you see that material getting a bit grimy, a bit gross, I know it's not nice to talk about, but you know, we're in the world of infectious diseases, so we can talk about gross things. You got your saliva and spit all over the inside. It doesn't, you know, it's not going to work as well. So if you start to see it getting a little weathered, it's time to chuck it and get a new one. But you can reuse them, and people do reuse them, and you can. So that, you know, it depends on how much you eat and spit while using your mask. Not the nicest answer, but that's the honest answer.
Thanks for that. I really appreciate it. Next question. What do you know about how long COVID lasts? So this individual caught COVID in December 2020. They have bouts of exhaustion, but before that happens, they feel like they had the flu again. They got tested, had a fever at a time of testing, came back negative. After though, they felt flu symptoms, needing to lay down, and sometimes it's an entire day. Is there any medical data on the recovery periods?
Yeah. So, you know, it's really interesting. If you lined up, I don't know, let's just pick an age. Let's say 50-year-olds, because that's older than me, and I feel better about myself. So let's pick a bunch of 50-year-olds. Let's say 10 50-year-olds. Both the same weight, both the same medical conditions, and we give each one of them COVID-19. Some people, and all of them are, let's just say all of them are vaccinated, okay? Some people won't get this infection. Some people will fight it off. Some people will get the infection, but they don't feel any symptoms whatsoever. You know, you can detect it in them if you swab them, but you won't feel any symptoms. Some people will get a little mild illness. Some people might have a cough, feel crummy, maybe have a fever for a little bit of time and recover after a day or two and be totally fine. And some people might get really sick, even if they've been vaccinated. They might feel really crummy. They're not going to land in the hospital. They're not going to die, but they'll feel crummy for a long period of time. You can give the exact same person or a bunch of people the exact same virus and have completely different responses. And that's why there's just more to it than the virus. It's you, it's your genetics, it's your body, it's how your body responds to the virus. And we often forget that that's a really important component. It's not just the virus itself, it's your response to the virus. So that's a long-winded way of saying some people do better than others. In general, after about 10 days, regardless of how you're feeling, after about 10 days, you're not really contagious to other people. Doesn't mean you're feeling better. It just means you're not contagious to other people. And you have people whose symptoms wax and wane. So they feel crummy, then they feel a little better, then they feel a little crummy again. And it can go on and on. Now, some people develop some more chronic symptoms, even after the serious bit, the most serious bit resolves. You might feel crummy for 5 days, 10 days. Most people are on the shorter end of the spectrum now if they've been vaccinated. But once they recover from that, they still feel lethargic. They feel tired. They just don't feel themselves. And that can last for a while, unfortunately. We have some people who have chronic symptoms that last for several months afterwards. Mostly it's okay. Rarely it can be debilitating, but for the most part, it's okay. People can get about their day. They just don't feel themselves. Luckily, with time, the vast majority of people get better. With time, the vast majority of people get better and they get back to their old selves. But yeah, it can take longer than in some than others.
Thank you so much for that. This is a question in terms of a little bit of a policy question, but would love to get your perspective on it. Why are experts in Canada suggesting lockdowns when most of the world is not locked down like we are, while most in Canada are vaccinated? Oh, you're on mute.
I don't know how that happened. Okay, that's a really, really good question. 2 points, and I love this because it's sort of a policy and society level question. There's a bit of opinion here as well. So opinion, this is the opinion part, not the policy part. I believe that the government's approach to COVID should be reflective of the people's will, okay? If you want to have lockdowns and tight restrictions, it should be the will of the people. If you want to let it rip and have no restrictions, it should be the will of the people. But like anything else, for every action you have, there's consequences. If you keep these tight, strict restrictions, obviously we know what the consequences are. We're all living through it. And we know what the social, emotional, economic consequences are. On the other hand, if you look at a place like Florida or Texas, where there's very few restrictions, that's a choice. And you have more freedom. Of course you have more freedom, but the consequence is there's a lot more infection, which there is. There's a lot more death, which there is. And if you look at the deaths per capita, the infections per capita in those places, it's way higher, like way higher than what we have. So that's the opinion piece. We should choose. It should be up to us. It's a democratic country. We should choose. Having said that, in Canada, we kind of don't have that choice. We kind of don't. Why? Because our healthcare system isn't equipped to cope with a large number of cases at any point in time. We don't have the capacity. We just don't. Like in Florida, you have the choice. You have a ton more hospital beds per person. You have more ICU beds per person. You have more resources per person. We don't have the option in Canada. Our healthcare system gets overwhelmed very quickly when you have so many infections over a short period of time. That's what happened in not really so much wave 1, but that's what happened in wave 2. That's what happened in wave 3. That's what's happening in this wave right now. Here's a neat example. I used to work in the United States. I used to work in Boston. And the hospital I worked in Boston, during one of their waves, wave 2 or 3, they had a ton of sick people they were looking after. And they had converted a lot of the hospital into a big intensive care unit. They had about 200 people in the ICU in this one hospital in Boston. Well, the whole province of Alberta shut down when there were 200 people in the ICU, in the entire province of Alberta. Okay, they had no more ICU capacity in the province. They were flying people out of province for medical care, and their healthcare system ground to a halt, and the province started to grind to a halt because of it. Okay, because of 200 people in the ICU in the entire province of Alberta, whereas one hospital in one city in the United States had that exact same number of people in the ICU. So just a reflection of, we don't have the same capacity that they do in the United States. So even if we wanted to say, enough of these restrictions, let's let her rip, we would really be in trouble, because, you know, if you call 911, there's no ambulance coming. If you need heart surgery, good luck. All the resources are geared towards helping people with COVID. If you have a cancer surgery that you need, sorry, tough luck, should have had cancer next year. We're too busy dealing with COVID this year. So like, we just don't have the capacity, unfortunately.
And the next question is actually a great segue based off your last one. It's talking about home care. So if we can get basic home care instructions on what to do if you get COVID Omicron and you can't get tested to confirm. The guidance on how to care for at-home infected family members has changed throughout the course of the pandemic, from self-isolation, no Advil, etc., and other harmful viral suggestions on social media. So the question is, what is the right thing to do when you're taking care of someone or yourself at home with COVID or suspected COVID?
Okay, I love this. So for starters, I'm full disclosure, I have no idea what their published guidelines are for caring at home, but I'll let you know as an infectious disease doc what I would do if I'm caring for someone at home with COVID. But I'm sure there's some nice printout somewhere, so I might miss a few things on the printout. But remember, most people who get this aren't going to need to be hospitalized. Most people won't. So first you have to recognize, can I safely be cared for at home, or do I need to go to the hospital? Things that should bring you into the hospital. Number one, you can't care for yourself at home. You're so sick that you just can't care for yourself at home, or no one's there to care for you. Number two, you're not drinking. Okay, if you're not eating and drinking, you're going to get dehydrated and you're going to need help. Okay, and number three, if you're having trouble breathing. If you're having trouble breathing, you should be in hospital. Okay, people are going to have a cough and a cold, but I'm talking about like your breathing is actually worsening. Those are the three things that should bring you into hospital. If you don't have those, you can monitor yourself at home and care for yourself at home. And obviously, if you develop one of those three things, sure, come on into hospital. Otherwise, what do? Hey, if you've got a fever, take a Tylenol, acetaminophen. Okay, take a Tylenol. Stay hydrated. That means not just drinking water. That means drinking water and electrolytes, the right sugars and salts. You can go to any drugstore and get the Pedialyte or the electrolyte things. It tastes disgusting. You can also just eat chicken soup or whatever you like, which has a ton of salts and carbs in it and has fluids, and that's good as well. Or drink Gatorade or something like that. It might be a little more palatable than the Pedialyte hydration therapy stuff. But stay hydrated. Make sure there's got fluids and electrolytes in it. Treat the fever with Tylenol. Get some rest. If you have symptoms of COVID-19 and you don't have a rapid test available, assume that you're positive and stay home. Now you're going to hear you need to stay home for 5 days. You know what? Some people are still contagious after 5 days. If you have the option of staying home another day or two, I think it's worthwhile doing that. And of course, when you do leave the house, even when you're starting to feel better, your fever's gone and you're feeling better, it's really important that you continue to wear your mask, especially in indoor settings when you're around others. You really should be wearing a mask indoors, even after you leave the house. We should be doing that all the time, but after you've recovered, it's especially important that we're mindful of that. Sometimes we get a little lazy or sloppy with the mask. So that's a really important point. And of course, if you need help, call for help, and call sooner rather than later. I know everyone's got good friends and good neighbors that are around, and that's helpful. That doesn't mean they come inside the house, right? You don't want them to get infected. But if you need a little care package of your favorite food or something like that, someone could drop it off on your doorstep. You got to be careful that everyone in the house is probably exposed, and they shouldn't be around other people as well, because they might get infected as well.
Thanks for that. Next question is around natural remedies. Do you have any suggestions for natural remedies, and are there natural ways to boost your immune system before infection?
Yeah, there are a few tricks to boost your immune system. I feel like this is one of those BuzzFeed's commercial. Here's what doctors don't want you to know. But no, here's the ways to boost your immune system. It's really straightforward. Number one, get a good night's sleep. Okay. That's so good for your immune system. Number 2, exercise regularly. Okay. And number 3, eat a well-balanced diet. Okay. That's all you really need to do. There's no magic. There's no vitamin this or supplement that'll boost your immune system. It's good diet, good sleep, good exercise. It is by far the best thing you can do. Now, who practices what they preach? I'm not sleeping. I don't think anyone on this call who's in a leadership position is sleeping. You guys are working around the clock. But in all fairness, if we really want to do the best for our immune system, that's it. Some of these supplements, and again, I'm not anti-supplement. I get it. I trained in medicine and stuff. I don't think a lot of these supplements are going to hurt you. I just don't think they're going to help as much as people say. And you'll swear people say, you just got to load up on vitamin D, or you just got to load up on vitamin C. It's not going to hurt. It can only help. Here's the problem. If it's starting to hurt your pocketbook, your wallet, it's a problem. Because whenever any of these are studied in a real manner, like head-to-head comparisons, they don't work. They don't work. We wish they would. It'd be wonderful. People are saying, oh, this is the pharmaceutical companies trying to make money. I don't work for a pharmaceutical company. I'd love it if there was a simple, cheap remedy that worked. This would be amazing. Problem is it doesn't. You can take vitamins, minerals, supplements, whatever you like, as long as it's not hurting your wallet, fine, but it's really not going to help. You want to boost your immune system and prepare, be in good shape, get a good night's sleep, eat a well-balanced diet, and get your vaccine.
So I'm going to ask the next 2 questions in a 2-part question. They are both related, but the question is it projected in the medical science community that since Omicron is a milder variant, that future variants will also be milder? Or is it possible for more serious variants in the future? And then the second question is, are people getting Delta still, or is it all Omicron now?
Geez, those are tough. So the first question's tough. That's a tough question. I don't know. There's nothing to guarantee that another variant is more mild. That's a really good question. It actually doesn't have to be that way. Like you can evolve or mutate into something that's really transmissible and causes more significant symptoms that could push out Omicron. People like to think it just gets milder and milder and milder. That's not what happened. It emerged from Wuhan, China, and then it changed into something worse. It changed into the Alpha variant, which was pretty nasty. Then it changed into the Delta variant, which was also pretty nasty. And then it didn't change. And then we got another variant, Omicron, which is less nasty. So it doesn't always have to go towards mild. It can go towards more virulent or more severe and more mild. So I don't know what the next variant is going to be, but there will be another variant. That's for sure. The second point is, are people still getting Delta, or is it all Omicron? It's almost all Omicron, not 100%, but it's almost all Omicron. Some of the ICU patients in the ICU are Delta because it does take time for people to get sick. And some of those people in the ICU still have a Delta infection. There might still be little pockets of Delta around here and there, but the vast majority, like probably over 90% of this, is Omicron.
The next question's a big one as well, and very important, but it's how do we talk to our teenagers? And the example is the teenager is tired of hearing about COVID, as most teenagers are, has several barriers to why he won't get vaccinated, allergies, terrified of needles, etc. Doesn't want to hear about vaccinations, will storm out of the room. Is there any advice that you could give on how to talk to our teenagers?
Yeah, this is a great question. Comes up a lot. Here's how you don't talk to teenagers. You don't get a guy like me, who the teenager's never seen before, who's some doctor who doesn't live in the community. Like, what the hell? They don't listen. They're not going to listen to me. My own kids don't listen to me either, let alone someone's teenager in a community that I don't live in. The real way to do this is to have a very dedicated and comprehensive communication strategy. Who do the teenagers listen to? Who do they look up to? And really work with those individuals to promote sound public health, right? Are there local leaders in the community? Who's cool? Who's influential? who has respect, and you just keep flooding Facebook, the radio station, billboards, Instagram, social media, etc., with strong, positive, honest, and accurate messaging by people who are trustworthy for those individuals. That's how you do it. Now, sometimes you have to, for lack of a better word, arm those individuals with good information to say, because they might not have all the answers. But that's where conversations like what we're having are so good, right? We arm ourselves with quality, factual information, and have influential people who are looked up to and who are respected help convey that information. And then, of course, there's no snapping the fingers, the job's done. This takes time and pressure. And with time and ongoing communication, you'll see many, many more people will get vaccinated. The other way too is this person brought up a really interesting point, the needle phobia, the allergies. Like, you have to have some honest communications about, you can have a million allergies, but it's extremely rare to have an allergy to the COVID-19 vaccine, right? We know what the ingredients are. Very, very few people have that allergy. People have phobias of needles. That's real. That's a real deal. And you can have vaccine clinics set up that are really designed for people who are scared of needles. And there's a way to do this. It just takes some planning and strategy. I really think getting strong community leaders who are looked up to and respected and sought after and thought is cool to deliver these messages on platforms where people are is the best. And then the next point is, you put the vaccine where people are, right? You make it easy. You don't have to make a trip to the vaccine clinic. You bring the vaccine clinic to the skateboard park, or to the school, or to the hockey rink, or to the arcade. I don't know what kids do these days. Is there still an arcade? Like, anyways, you know what I mean? You bring the vaccines to them and lower any possible barrier.
Really great advice on that. Thank you very much for that. We got one final question here, and I know we're just at time. Thank you for the, we're just about at time actually. But the question is, if most people won't need to be hospitalized, then why would we say that our health care system isn't equipped to handle this?
Excellent question. So it's true. That's a great point. It's like, so what's the deal? If most people don't need to be in hospital, what's the big deal? And the answer is, right. A very, very small percentage of people who get COVID need to be in hospital. But when there's 14.5 million people in Ontario, when 14.5 million people in Ontario get COVID at the same time, a small percentage of a massive number of people still ends up being a lot of people, and a lot of people at once. And our healthcare system isn't designed to accommodate that number of people at once. We've never had this many people in hospital with COVID than ever before. Yeah, this is a milder variant compared to the Delta variant. It is. But when it's very transmissible, and when so many people get infected at over a short period of time, suddenly that very small percentage of people that need to be in hospital ends up being a lot of people in hospital. And that's exactly what you're seeing right now. It's going to be a tough couple of weeks. Hopefully we'll get through this, but I think it's going to be a tough couple of weeks moving forward.
Thanks for that, Dr. Isaac Bogoch. Very, very insightful. And we certainly thank you for taking the time to go through all of these community questions. Audrey, I see your hand. I'm wondering, is this related to Dr. Isaac, or are we going into the federal schools? Because I'll deal with the federal schools.
I've invited Travis here, as Shirley to invite Travis so he can answer the question about the schools, please.
Yeah, I'll deal with that after we finish with questions for Dr. Isaac.
Nathan, I have a question. It's Hazel.
I still have questions for him, Nate.
We're right at time, so I'll take a few questions from council because we're over the allotted time with the doctor. So if we can go quickly, I'll take 2 questions from councilors, if that's okay, doctor. I see you're not.
Absolutely.
Okay, so Audrey and then Hazel.
The question that I have for you is one of the 4th dose and travel across the borders to the United States or travel abroad.
Sorry, I missed it. What was it? Traveling abroad?
Fourth dose and traveling outside of Canada.
No, you don't need there's no fourth doses being given. The only places giving fourth doses are Israel's giving a fourth dose to people over the age of 60. And in Canada, fourth doses are going into people who have very compromised immune systems because of underlying medical conditions, and some people in long-term care facilities. The reason they're getting fourth doses in Canada, because we're saying this is a 3-dose vaccine, you need 3 doses at least right now. Those people, if they got 3 doses, I'm just gonna, this isn't exactly right, but it's the best way to explain it. When those people get 3 doses, their body only sees 2 doses. When they get a 4th dose, their body basically sees 3 doses. That's why we're doing that in Canada for a very narrow spectrum. That's what we're doing now. 4th dose is moving forward for the general public. No, not even close to that. We need more information on how to do that. Traveling over the border of the United States. Yeah, I mean, the Public Health Agency of Canada says don't travel internationally, but many people are. If you're going to the United States, I believe you need proof of vaccination, and you also need a negative test, I believe, still. I'm not sure. Those changed. And then, of course, when you come back to Canada, you need a negative test to come back to Canada as well within 72 hours of your return to Canada.
Thanks for that, Doctor. I'll go to Hazel.
Yes, I just would like to ask the question with regard to, I know some church group people who refuse to have vaccines because they go based on faith. I'm not sure even what to ask, but when somebody tells you that that's their choice to just go based on faith, and in my mind, even though, you know, your commitment to your religion, etc., still in all, I believe that you have to help yourself.
Yeah.
The saying's always been, God helps those who help themselves. I don't know how to answer anybody's questions or their comments when they don't speak too highly about the vaccines. Do you have any suggestions on how you could address that?
It's a great question, Hazel. A couple of points. One is every major world religious leader, every single religious leader, major religious leader on the planet has come out saying you should get the vaccine. Like the Pope did, the major rabbis did, the major imams did, like every significant global religious leader has said, get the vaccine. That's pretty helpful and that's pretty telling. You know, it's not nice to say, but we know that sometimes the religions tend to fight a bit and they're pretty much on the same page with this one, right? Like everyone's saying the same thing. When you come down to a more local level, I don't know of any religious leaders who have said don't get the vaccine. Even here in Canada, you have almost all the religious leaders come out in favor of getting the vaccine because people recognize this is how you protect your community. Yeah. So, I mean, when you've got the religious leaders saying get the vaccine, who are we to say, you know, oh, I don't know, it's not really aligned with my religion? No, the religious leadership is saying get vaccinated. You should be getting vaccinated. That's my approach, but I'm sure there's others on the call that might have a better approach.
Thank you.
Thank you so much, Dr. Isaac Bogoch. We've come to the end of our Q&A with you. Really deeply appreciate the candor and the frankness of your responses. Really brought everything back down to earth and some real strategies that we have to consider going forward as we continue to battle this on a number of fronts. So I really appreciate the time that you have given us yesterday and today. I know you're extremely busy. And for the most part, I think the community, we were at one of our highest view rates that we've ever had on council. So really appreciate that. You reached a lot of our citizens. So great job on that.
Thanks so much
Wendy,
for having me.
before, I think Wendy's got a couple comments as well.
Yeah, thanks, Nathan. Just wanted to say, in terms of Audrey's question about cross-border, yesterday, I think the US put Canada on its advisory for places not to go. So funny, but not. it's quite alarming. But just want to thank you, Isaac, once again for coming out. And next up, we're hoping to schedule you on our local radio so that we can do live call-ins there. So we'll be in touch to set that up as well. So thanks so much.
Thanks for having me on. It's lovely to chat with everybody. Those are some fantastic questions. And again, I look forward to being in touch in the future. Be well, everyone. Have a nice evening.
Thank you.
Yourself, get some rest. I also have to plug that. Our experts out there, they got a rest too. Want to thank Councillor Paulus Bombury for bringing Travis on board to answer the question on where we're at on the federal schools as it relates to opening. So with that, Travis, we got a question while Dr. Isaac Bogoch was going through his spiel regarding, because we've started following provincial guidelines, we know that the province in their school system is going back to school on Monday. So if you can just provide a quick update to the community on what the thinking is and what the advice is going forward for our schools within the territory.
Now for inviting me this evening. We're looking at still, I met with Six Nations incident management team today, and the advice from public health and the team was to stay with a February date. The date we did put out was February 14th. Hearing from the doctor just now, he says it's going to be a rough next couple of weeks when the province is going to reopen schools. So holding off on reopening schools for at least another few weeks is I think is what will come out of our meeting today with the incident management team. So I did the letter that was out to the community and the families was February 14th. And as of right now, we're going to stay with that. I did have a disclaimer in there that if possible, we would open up sooner. But at this time, it was advised not to open up as the public schools on January 17th. So I do meet with the incident management team and emergency control group weekly. And we look at all the information and at the time and make decisions on from there. So I guess updating again each week, and then if we are able to go to in-person learning sooner, we will. But as of right now, we'll be with the February 14th deadline, our target date.
Thank you for that, Travis. We are getting a few questions, but I just wanted to also offer Travis, one of the things myself and Chief Hill, when he returns, we'll be doing is we're going to be daily updates at about 11:30 to the community on both radio stations. So if there's any updates you want to go out on a daily basis, just let us know and we'll be happy to provide that for them. So with that, we have a question coming in from Councillor Johnson.
Hi, Travis. Just want to make sure, will you be sending home more rapid antigen tests? I know you sent some home with students, before the holidays with anticipation of returning, but I'm pretty sure that everybody's used those already. So as we try to get kits out to homes, will you be doing the same with students over the next few weeks until they return? One question. Second question, same question I always ask, are there still additional supports that parents can reach out to schools for to support their kids through this process of at-home learning?
Yes, now for the question, Wendy. With the rapid allergen tests, yeah, we did send them home with all the students and the holidays. As you know, there's a worldwide shortage on the testing now. We have put in more orders to have at the school, but as of right now, we don't have any more of the testing kits. We're hoping, it's day by day of when things coming in. We're hoping in the next short bit that we will have some rapid, more testing at the school. And from there, also the N95 masks. I've been able to, I guess, secure the KN95 masks for now for staff. So that was another step in the right direction. Along with any extras from the school. I know the nutrition program is handing out goodie bags every I think it's Monday, Tuesday, and Wednesday, but the information's all shared through the schools, and with the remote learning. I know it's not ideal, but reaching out to each school and getting support from your teachers and administration. A lot of information is on our Edmodo shell, and utilizing that is a great resource.
Thank you for that, Travis. Is there any more questions from council while we have Travis with us this evening? Okay, also don't see anything in the chat. So with that, deep thanks, Travis, for quickly joining us this evening and giving the update to the community on where
we're at. Very informative presentation from Dr. Isaac. It was really nice to see.
Thanks. Yeah, I'll go for that. Okay, council, just gonna take a bit of a breath, but that was a great session with Dr. Isaac. Numbers skyrocketed in terms of community participation in that. So, with that, that brings us back to the agenda. And we're looking to do the adoption of the General Council minutes of December 14th.
It's Melba. I'll move on a minute.
Moved by Melba, and I saw Sherry Lynn seconding. Okay, I'm gonna stop. Is there any questions, changes, deletions to the minutes? Hearing none, all in favor?
Favor.
Any opposed? Wendy, do you have a question?
I do. I wasn't here for that meeting, but I'm listed as present, just FYI.
Okay, we'll make that change, definitely. Thank you for catching that. So I'm looking to pass these motions with a noted change. All in favor? Any opposed? Seeing and hearing none, motion has passed. Political updates, just want to mention here, our focus has been the recent surge and the outbreak. So we've been focusing as council, all of our efforts on that advocacy and putting together a strategy on a number of fronts. There's a number of other political updates. I did want to reference the Child Welfare Agreement. As many of you have likely seen in the news over the last 2 weeks, there is an agreement in principle. So what that means by way of an agreement in principle is that the parties that have negotiated have agreed. Now, communities such as ours will be seeing the details over the next few months, with the final ratification happening this summer. So definitely more information coming on that, more details as Six Nations sees some of the details to this agreement. So I don't know if any other councillors have any political updates at this time. I just wanted to reference those two and where our energies are spent. Seeing none. Scheduling, I know Sherry Lynn deferred the gaming policy review, which has been postponed due to COVID, but just to go over the next few weeks, we have General Council tonight. We have Building and Infrastructure tomorrow, 9 o'clock. General Finance on January 17th, and then Corporate and Emergency again on January 19th. So before I ask for a motion to adjourn, I just want to, again, inform the community that as it relates to the recent surge in COVID-19, we released the strategy today. We'll have a number of community updates via the radio, as well as look out in your mailboxes for our written updates as well, so that we're reaching as many community members as possible. So with that, I want to thank the community for their time, their energy, and their participation today with Dr. Isaac Bogoch. I think it was a great session. And have a safe Stay warm and stay safe tonight as we look to close out this meeting. So with that, I'll ask for a motion to adjourn. Moved by Sherry Lynn, second by Wendy. All in favor? I see no opposed, so motion is passed. Now go community.